Hi, I'm Dr. Hussein Musa,
Hi, I'm Dr. Adatone Musa.
and we are the dynamic duo known as parents because we raised three boys.
I love my three boys. They bounce off the walls just on a daily basis.
I love my three boys because I am being recorded.
Okay.
All right, this is Healing Talks with the Kingdom Docs. We've been talking about our healthcare system and how in traditional healthcare, there's a lot of pressure on physicians to see patients. They have to see typically about 20 patients a day. They can have a panel of 1,000 to 2,000 patients or even more.
Yeah.
There's a lot of middlemen. There's a lot of insurance barriers. And there's a lot of things that prevent you as a patient from receiving care.
And honestly, this can cause a lot of things to fall through the cracks because the doctor or the physician is overwhelmed with patients and messages and patient concerns, especially simple counseling that may not have been able to be done just because there's so many patients they have to see.
And I still want to give credit to all the physicians out there and caretakers and providers that they're doing an excellent job because they're doing so much with so little time. It's not that they're overwhelmed and they don't get the job done.
They still do.
They get the job done, but at a cost. And that cost often is their personal time. It can be lost revenue for the practice because sometimes you just stop billing things because you want to give patients care.
Absolutely, absolutely.
Now, we're looking at another model, which is direct care, which is a way for us to see patients directly and remove the barriers that can prevent you from getting care and access to a physician. And we believe this access and this care can improve your health, and that's why we're talking about it.
Right. Imagine instead of seeing a patient or your doctor in 10 minutes, you have 1 full hour to really sit down and talk. The physician has enough time to delve into the root problem of your disease or disorder, and then he or she really goes into the treatment plan in detail, counsels you, gives you options or even potential side effects to the medications. And because of this detailed education, the patient understands what their diagnosis is and what the treatment plan is without any confusion.
Yes, I think that leads to a level of excellence in care that's just very hard to reproduce when you have limited time.
Yes.
I remember in medical school, one of the first things you learn to do as a medical student?
I don't remember. What is it?
It wasn't that far back.
Yeah, I don't want to date myself.
Well, we learned how to take a history, a patient history. True. And the best thing...
I was thinking about organic chemistry or something.
Oh, that's awful. No, but when you take a patient's history, you're this med student and you have all the time in the world. And the patients loved seeing you because you would go there and you would talk with them and you would take a good hour learning their life history. And the more experienced physicians, they would always send the med student into the room, let them take a great report, and then the med student would summarize their medical history, and the patient would feel that they've got the best care ever, even though they saw a med student who technically isn't quite a doctor just yet.
But they had the time.
Yes.
And in addition to that, you got a better diagnosis, a more accurate diagnosis. I'll give one very short example. I was a resident and I got called to the emergency department for seizures.
Oh no.
And this doctor also said the patient had maybe a stroke and could not move the left arm. I went downstairs, did a very detailed exam for an hour, examined the patient and took the history, and I realized it was just a broken arm. The patient did not have a stroke. So it's very important to really take that time.
Wow. That's all the time we actually have today on Healing Talks with the Kingdom Docs. Please visit us at kingdomdocs.com.
Bye-bye.
God bless.